And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that Candace, of course, help change people's lives.
They certainly do, and we're going to start with one of the top plastic surgeons in all of the Dallas and Fort Worth area. It's Dr. David Azouz.
Carrie is a young lady who complained of breast hypoplasia, which means small breasts. Her breasts were small and she wanted larger breasts. She also had breasts that were not what she thought was normal because she had a tubular breast deformity. What that means is that the nipple was very, very prominent and pointy as opposed to a more natural appearance. So she wanted breast augmentation, larger breasts. She was an A cup and she wanted more of a CD cup. And she also wanted to correct her tubular breast deformity or the prominent nipples that she had.
It was just something I really wanted. I wasn't comfortable with my body at all. I couldn't wear bikinis at all. I couldn't talk in public. So I just thought if I get the surgery, that it would help me out. When I first met Dr. Azouz, I thought he was very friendly and was always smiling, and that would make me smile and feel more comfortable. And he explained everything perfect to me.
Tubular breast deformity is quite common. Many women have a tubular breast deformity where the nipple doesn't sort of lie flat on the breast and is very prominent. In very severe cases, the breast looks like a tube with a pointy nipple on the end. So the object is to make it rounder, to give them cleavage so they don't have these pointy breasts. In Carrie's case, what we did is a correction of her tubular breast deformity, and we also gave her increased volume.
At first I was an A cup and now I'm a 36D, and I just love that. I was surprised. I couldn't stop staring at myself in the mirror, looking at the new me. And I would just stay in my room and just keep looking at myself, and I would turn sideways and all that. I love going shopping now. I really do. Because you can wear whatever you want without worrying about if the cut's too low, how you're gonna look in it. I love wearing different stuff now. The dresses, the bikinis, everything. I just love it.
I had torn my ACL about in 2008, I believe, playing soccer. And it was something that I just kind of tried to rehab without having the surgery. I just was concerned about finding the right doctor to have it done. Honestly, I didn't have the time at the time to go through the rehab process. And what happened was in the backyard hanging a swing up for my daughter and jumped off the ladder because it started to move, and when I jumped, I hurt it again.
Well, most any sporting event that requires cutting puts you at risk of an ACL tear. Soccer, downhill skiing, football, basketball. It's a ligament that we can pretty much put back where it's supposed to be to try to allow you to return to that previous state of, or that previous level of activity.
I went to see Dr. Newton, and first visit, he said absolutely that my ACL was torn, and there was no reason at my age that I should leave it that way, that it wasn't a very difficult surgery.
It's an outpatient procedure this day and age, and the patient can walk even out of the hospital if they feel like it. Now, sometimes I will use crutches if they need them, but most of the time people don't need crutches even the day of surgery. I will use a CPM machine, which is a motion machine, to help them get their motion back, and an ice machine to help them with their pain. But the first 6 weeks usually is just letting them get their motion back. I do use a brace post-operatively, and then after that, after they've had some healing, then I start working more on strength and then endurance training, and then hopefully activity-related exercises to get them back to sport.
And the surgery went excellent, better than I could have imagined. I wish it's something I'd have done a lot earlier, because I played a lot of sports for many years wearing a knee brace, and I didn't really need to do that. I'm continuing to do a little bit of the physical therapy. Since we're towards the end of this now, I can't wait to be able to get back out and play sports and just throw the ball with my kids in the backyard and not be concerned about my knee hurting, slipping again.
All of the doctors here at the Best Docs Network are dedicated to changing people's lives. Like our next best doctor is cosmetic dentist Dr. Guy Lewis.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, you know, over the age of 40, who a lot of times, you know, they take care of themselves, they stay in shape, they look great, but there's just some things they want to do to try to look younger. And for Sandy, you know, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
Most of us have allergies, you know, itchy nose, runny nose, itchy eyes, sneezing. It's no fun. There's lots of good treatment for that. First of all, avoidance. If you know what you're allergic to, stay away from it. Secondly, you can get allergy shots. That's kind of after trying other things first, but you can be tested for what you're allergic to, and then you take shots for it, and it desensitizes you to those things. There's also great medications, many of them over the counter. Now, there's 2 classes of antihistamines. That's the main treatment for your allergies. The old-timey antihistamines that we use, the chlorpheniramine and bromophenramine, there's lots of brand names, but those are the generic names. They're great for allergies. However, they can cause drowsiness, and they therefore developed new allergy medicines. These are 3 over-the-counter medications, such as loratadine, which is a generic name, and 2 others. These are great in that they don't cause drowsiness. The problem is they're not quite as strong. So I think if you're going to be driving and carrying kids around in your car, I think it's best to use the non-drowsy ones. But if they don't work, you better use some of the old-timey stuff that works real well.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that we're removed so that we're sure that we've gotten all of the skin cancer.
The first time I had any problem was out in California. And I had some work done in here. But the doctor told me, he says it might come back, because they didn't have the Mohs system at that time. Then I had this one.
Mr. Wattier presented with a recurrent squamous cell carcinoma involving the right posterior auricular area. The posterior auricular area is the area behind the ear and extends onto the anterior portion of the scalp and the upper portion of the neck. It also involved the posterior aspect of the right earlobe. During Mohs surgery, we were able to get a clear margin. I believe it took 3 stages of Mohs surgery before we had clear margins. The resulting wound was approximately 3.5 centimeters long by 2.5 centimeters wide. What we did was come up with an advancement flap that required removal of Burroughs triangles, small little triangles of tissue at the superior and inferior edge of the wound. We then undermined the tissue, advanced it to the edge of the posterior auricular sulcus, sutured that in place, and then used one of the Burroughs triangles that were excised as a skin graft for the defect on the posterior aspect of the right earlobe.
So you had to do a little patch in there. See, the ears aren't the same. See, I lost part of my ear here. It's healing up a lot better than I thought.
Well, he's now 4 months post-op. All of the sutured areas have healed very nicely. The skin graft took very nicely, and everything looks perfect.
These make you feel relaxed all the time. It really is nice.
As always, for more information about our incredible doctors or to see lots of videos, get tons of information, profiles, you can schedule appointments, check out our website. It's bestdocsnetwork.com.
bestdocsnetwork.com, that's the place to go. Also, you want to stay healthy? Head to the bestdocsnetwork.com, check it out. Right now, time to move on to our next doctor that helps change people's lives. It's Dr. Philip Swanson.
Before I went to see Dr. Swanson, I was 200 and something pounds. I had a 2-year-old little girl. I was on the sidelines a lot. You know, I was that big parent, not very healthy, not very active, and I wanted to participate more with her in her life and the things that were going on with her. She was 2, she was walking, running, and very active. So that's what drove me to go see Dr. Swanson.
The advantage of the sleeve is that when you remove that part of the stomach, you change the communication of your insides. People think of the stomach as just a bag to hold some food, and it makes some acid, and yeah, there it is. No, the stomach is an amazing organ. It manufactures several hundred chemicals that communicate to the pancreas and the liver and the brain and the fatty tissues. And all that communication goes on all the time. So when you remove part of the stomach, you change that communication, and that's when amazing things happen.
Within 2 weeks, 3 weeks of the surgery, I'd already had dramatic weight loss. To date, it's been a year from my surgery and I've lost 120 pounds. Life has changed dramatically. When I go to the doctor, my doctor is just floored at the progress that I've made.
People seem to have a place where they live as far as their weight. They've been 300 pounds for the past 10 years. Their stomach and their brain and their fatty tissue communicates and says, you need to live at 300. When you change that communication, on the day of surgery, their brain now thinks you should weigh 160. When your brain thinks you should be 160, and it's getting the signals from the fatty tissue saying, oh, we got all this extra reserve out here, the brain says, we got plenty of energy. We don't need to eat. And these people are not hungry. It's amazing.
If I hadn't had the surgery, I don't know what it would be like, to be honest. I mean, I wasn't there. I work out 3-4 times a week and it's not hard and it's easy now. And before it was just so hard, it hurt my knees, it just wasn't fun. And now I can go to the gym and I don't mind wearing the gym clothes and it's great. It's fantastic.
One of the misconceptions about plastic surgery is that everybody comes in as a model, wannabe, and so forth, but that's not the case at all. There are all different needs of people who come in through the door.
Last year I had a mammogram and I have had 2 cysts in my right breast for a couple of years and was when I decided that I would go ahead with the procedure. I've been very pleased with Dr. Wilcox. His information, his bedside manner, he's very informative. He takes all of the time that you feel like you would want, and any questions that I've had, he's taken the time to draw me pictures and to answer my questions. And his nursing staff and the recovery room, I've never seen anything like it. The nursing staff were so caring, and I never had a fear of anything, of taking infection or anything, because they were so caring and so attentive to my needs.
Listening to the patient, understanding what they think they're going to get, and reassuring them what we can and can't deliver, then we can achieve those goals. Everybody's happy.
We've been using preferred imaging since 2001, since I started practicing here, and patients universally come back telling us what a great experience it was. I'm an orthopedic surgeon, board certified in orthopedic surgery and sports medicine. I do a customized knee replacement that is a special technique that is customized for the individual patient. So that knee replacement is based off of an MRI that the patient gets of their knee, their hip, and their ankle. And through that MRI, we feed that into a computer, and it creates a three-dimensional model of their whole leg. And that allows us to be much more accurate in the way that we do the surgery. So the MRI for that knee replacement technique is absolutely essential. It's a special MRI, and Preferred Imaging is specially certified and trained to do these special MRIs. Well, we love Preferred because they do a fantastic job for our patients. They get our patients in right away. They do a wonderful job at customer service and making sure the patient's comfortable through the whole experience, and really just guiding the patient from start to finish through that sometimes scary experience, and making sure that they are as comfortable as they can be. Well, MRI is a very integral part of an orthopedic practice because it's the best imaging test for musculoskeletal problems. So we use MRI quite a bit to establish a specific diagnosis, and that saves a lot of time and effort. You know, the quicker you can establish a diagnosis, the quicker you can get to the bottom of the problem and get it fixed. One of the greatest things about Preferred Imaging is that they have incredible hours, operating hours. They work from early morning till late at night and 7 days a week, and that convenience is an incredible thing for our patients because they don't have to miss work oftentimes, and they can get the MRI done right away, immediately, so that we get an answer to what's causing their problem, and we can get busy fixing it. We send patients to Preferred Imaging because we have full confidence in their ability to do a really good job for our patients, and they treat them well, and that reflects well on us.
For more information on any of the outstanding doctors you see on today's show and request an appointment, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Right now it's time to focus in on our next best doctor, one of the best pain management specialists in the entire Dallas-Fort Worth area. It's Dr. Jason Williams.
When patients come to see me, they're usually at a point where the pain is starting to affect their daily life, whether it be at work, their personal life, their moods, anything of that nature. They notice that the normal things that they used to do aren't really helping anymore, such as taking medicines that they get over the counter, or going to see a massage therapist, chiropractor, acupuncture. All those things seem to be failing, even if they have worked in the past. So at that point, the patients are at a point where they feel that there's something else going on, and they need to be evaluated to figure out what is wrong with their low back or neck. When a patient comes in my clinic, first what I like to do is sit down with the patient and learn about what's been going on with them. That's, do an extensive history, spend the time with the patient to find out why they're hurting, where they're hurting, how long they've been hurting, and that's in addition to a physical exam to see if I can't evaluate the nature of the pain that the patient's having. When patients come to my clinic, this is a perfect example of what a patient might be experiencing that could be causing their low back pain or leg pain, or even their neck pain and arm pain. This is a herniated disc, or an example of a herniated disc where the nucleus pulposus, or the center of the disc material, has actually excreted through this annulus fibrosis. When this happens, this can cause spinal stenosis. It can actually impinge upon nerves in the spinal canal itself, or if you can imagine a nerve root coming across this, coming out, exiting to your leg or your arm, and it actually getting pinched off by this herniated or bulging disc. What the Acuroscope procedure does is it addresses a condition like this. The laser energy is focused right here on the actual bulging or herniated disc, where it can reduce the herniation and improve circulation to the nerve and reduce impingement on the nerve, and patients can have immediate improvement of their symptoms and pain.
Wouldn't it be great if we had a blood test that could tell you if you had cancer or you don't have cancer? Well, we don't quite have that yet, at least for most cancers, and in the future we probably will. I would say within 5 years there will be tests that we can do on your blood that will tell us if you have a tendency towards certain cancers or if you even have cancer cells in your body. There's a lot of genetic testing and a lot of research going on, so there's great things are going to happen. Now, as it is now, there are certain tests, for example, for ovarian cancer. There's a test called CA125. You don't need that test unless you have a strong family history of things like cancer of the uterus or ovary cancer in your family. However, it is a good test and can tell us if that cancer is brewing. There are certain tests that help us with pancreas cancer. But in general, the blood test that you have when you do your physical give the doctor a clue as if you are at risk for cancer. For example, you might be anemic, or your platelets, which is part of your red blood cell count, may be high. There's also other things like liver tests that may be elevated and that indicate your cancer risk is high. So get your blood test done, check it out, and hopefully in the next 5 or 10 years there'll even be better blood tests.
We are here with the go-to guy as far as when it comes to bariatric surgery, Dr. Adam Smith. Welcome to In the Studio, the Best Docs Network In the Studio. And Dr. Smith, right off the top, tell us what makes your practice so different from others?
I think the one thing that sets us apart, or at least we feel makes us unique, is the fact that I've been through the same experience that our patients are going through. I've made those decisions, I've had the same struggles, I've had the surgery, gotten through the surgery, and been fairly successful after the surgery, and that's how we created our practice, to ensure that our patients get that experience from start to finish.
And with you doing that, you know how important it is to have the so-called personal touch with the patient.
Yeah, I think that the surgery is just kind of a turning point in a process that's really a lifelong lifestyle change. And the surgery is important, and it's an important tool that we use, but that's really just the beginning of a journey. And so we keep in touch, lifelong, long-term with the patients to keep them successful long-term.
That's great. Now, Dr. Smith, tell us, who is the perfect candidate for this type of surgery?
Well, I haven't met the perfect candidate yet, but we certainly like to see someone that has struggled, that has been overweight a significant amount of time, but have had some success. They've had some success on a short-term basis with diet or modifications of their behavior, but their genetics are such that they just can't keep the weight off. Those are the people where surgery can really help. It's not just a quick fix. It's someone that has really tried, struggled, and still needs just a little extra help to succeed.
Okay, you say that, and you're talking about a lot of overweight people that just cannot get those extra pounds off. Tell us now, what type of surgery is best?
Well, there is no perfect surgery. There is no perfect surgeon, although a lot of us may think we are from time to time. But the surgery is just a tool that our patients use to help them have a level playing field. If they've been overweight over 5 years, the deck is stacked against them. And whether they are the best dieter in the planet or the best exerciser on the planet, without a level playing field, which surgery gives them, none of them have the ability to have long-term success.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Infertility itself is tough enough to experience alone. A lot of patients do feel like they have nowhere to turn to, but fortunately, we're here in the community. We're lucky that at Dallas IVF, we have a one-stop shop type of center where the patient can come and receive a whole wider range of treatments and to help them get pregnant.
Some couples come to us because there's a male factor, sperm is poor. Some couples come to us because the woman has endometriosis or does not ovulate well. There's a whole range of reasons why couples come to us. About 15% of the patients we see in the office have what's called unexplained infertility. They have a completely normal workup, yet they're still unable to conceive.
Here at Dallas IVF, we offer a wider range of infertility treatments, ranging from basic aggressive therapy like taking medicines such as pills to grow an extra 1 or 2 eggs, combined with something called insemination, or IUI. That's where we'll take the partner sperm and place it closer to the eggs within the uterus. Another treatment that we offer is a very aggressive treatment called IVF, also called in vitro fertilization. What that is where everything that occurs in the tube, which is particularly fertilization and embryo development and growth, all that occurs in a glass dish in the lab. So in that way, we can actually find the healthiest embryo and place those back into the uterus.
If there's a structural reason why they can't conceive, the tubes are blocked, there's fibroids, polyps in the uterus, endometriosis, for these people, we often have to take them to the operating room and try and correct those abnormalities. We're fortunate we operate at Forest Park Medical Center at Frisco, which provides the full range of services that we need on all our surgical patients.
Infertility and infertility treatments is like an emotional roller coaster. Hope and excitement followed by despair and frustration, followed by hope and excitement. But one day, there will be a little baby at the end of the road. It's so rewarding, especially when the families come back and they are so excited to show us their little child. It really is the best part of what I do.
Thanks for tuning in for another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area that are changing people's lives. And you know, for more information on those doctors, to see more videos, you can even book appointments there. Check out our website, it's bestdocsnetwork.com.
And if you have a question or comment for us, send us an email at info@bestdocsnetwork.com. And Candace, guess what? The latest Best Docs Network magazine is now out, so check your local newsstand. So long, everyone. We will see you next week.